Great. Hello and welcome to Network Commons. This is the Build Healthy Places Network's live discussion series on cross-sector strategies to improve neighborhood health and well-being. Before I begin, I hope you and your families and your communities are healthy and safe during this crisis. We really appreciate the work that so many of you are doing to support your communities during the COVID-19 pandemic. And we're grateful that you're able to join us for this important and timely conversation. I just got word that we are just shy of 1,000 registrants, so maybe we're even over 1,000. Call your friends for this actual webinar. So we're definitely tapping into an area of key interest. My name is Doug Jutte. I'm a pediatrician and a public health professor at UC Berkeley. But most importantly for today, I'm also the executive director at the Build Healthy Places Network. We're a national nonprofit with the mission of shifting the way organizations work across the health, community development, and finance sectors in order to collectively advance equity, reduce poverty, and improve health in neighborhoods across the United States. Our Network Commons is one of the many ways that we bring together leaders from across sectors to share their expertise, discuss challenges, and highlight opportunities and successes. So today I have the pleasure of serving as the moderator for our discussion. We're lucky to be joined by leadership of 3 organizations doing innovative and exemplary work as they respond to the crisis of the coronavirus pandemic that we're now enduring. As all of you have doubtless seen, COVID-19 has revealed more clearly than ever how interconnections, or the lack of connections, across and between systems and sectors can impact our health. In addition to quality and healthcare and access to that healthcare, we've also seen vividly the ways that housing, employment, transportation, education, and food systems have emerged as key factors affecting the public's health, with the forces of racism and inequality leaving some communities disproportionately impacted by the virus. It's increasingly clear the pandemic is emerging not just as a health crisis, but as a community crisis. One that requires a combined response from the community development, finance, public health, and healthcare sectors. We'll be hearing today about how these sectors are working together to drive meaningful investments towards our hardest hit communities, and discussing what role community development investments and cross-sector partnerships can have in strengthening the resilience and increasing equity in our post-pandemic world. But before we dive into these questions, let's take a quick poll of you, our audience. This is the first time we've tried this on Zoom. So we're going to put up a poll, and the question is, are you or your organization involved in any cross-sector collaborations or partnerships between health and community development? And that could be convening meetings together, serving on advisory boards or advisory groups, partnering on a project, or perhaps even co-investing. We'll give time for a few responses. Very impressive. We're running around 80%. Have some cross-sector work. Great. And I think you all can see that as well. Good. All righty, let's end that and I'll keep going. Let's see, what do we have? It ended up at 76% are doing some work and another 16% are exploring it. So pretty amazing. I'll close that. All right, back to, let's see. Okay, so now I'd like to introduce today's speakers. We'll be providing links in the chat box throughout the conversation for resources that come up, and we're going to add a link right now to the full biographies of our speakers. Let me close the poll that's still showing up on my screen. Okay, so first, I'd like to welcome Dr. Akilah Watkins-Butler, who is CEO of the Center for Community Progress, America's nonprofit leader for turning vacant spaces into vibrant places. I love that tagline, Akilah. As president and CEO, Dr. Watkins-Butler leads efforts to help grow equitable communities where vacant, abandoned, and deteriorated properties are transformed into assets for neighborhoods and neighbors. Next, I'd like to welcome Maurice Jones. He's president and CEO of the Local Initiative Support Corporation, known more commonly as LISC. He manages one of the country's largest community development organizations, supporting projects and programs to revitalize communities and bring greater economic opportunity to residents. And finally, I'd like to welcome Mikelle Moore. Mikelle is Senior Vice President and Chief Community Health Officer at Intermountain Healthcare, a Utah-based not-for-profit health system. Mikelle is charged with leading system-wide prevention and community health improvement efforts in support of Intermountain's mission of helping people live the healthiest lives possible. So I want to thank you all for coming. And I want to thank all of you again watching online. So quickly before we turn to questions, I want to give a quick note about technology for today's webinar. So Zoom has 2 features available to you at the bottom bar, the chat and the Q&A features. If you have any technology issues, please use the chat box feature and we can troubleshoot with you. That's also where we will provide information throughout the webinar. In addition, to provide questions for our speakers, you can use the Q&A feature. So if you have technological issues or to receive information, go to the chat box. If you want to provide a question for us, use the Q&A feature. So I'm going to kick off things with a few initial questions for our speakers, but we'll have plenty of time to get to our audience questions. I want to thank many of you who provided thoughtful questions prior to the event during the registration. We'll try to get to those as well as those that are coming in through Q&A. Also, if you're a Twitter user, we encourage you to share there any ideas, comments, innovations, quotes that you hear that you find compelling. Our hashtag for these are network comments, so hashtag network comments, all one word. And we'll also add to our chat box right now our Twitter handle as well as those for our speakers and organizations, so that makes using Twitter a little bit easier. So now we can get started. So I'd like to open today's discussion by first asking all three speakers to briefly describe your organization, as well as tell us about how your organization has responded in the very short term, the immediate response to the coronavirus pandemic. So Akilah, let's start with you.
Great, thank you so much, Doug. I want to thank Building Healthy Places Network and to the audience out there for giving me an opportunity to share our work today. I understand everybody's incredibly busy, so I just really appreciate the privilege and honor to be on a panel. A little bit about the Center for Community Progress. We are the only leading nonprofit that addresses and prevents property vacancy, blight, and deterioration. Our goal is to help revitalize communities. We have done that in more than 300 places across the country, mostly working in small and mid-sized cities, really helping them with local policy and being able to tap into state level policy for communities to develop the best and highest use for properties, right, that have been seen as blighted or vacant. What we're doing as it relates to the COVID crisis are a few things. One is that we have a policy level strategy that we are implementing, and that's everything from using our full weight as a national organization working with local governments to really push for high-level conversations around federal policies that we know that can benefit low-income and vulnerable populations. We're looking at everything from CRA support all the way to local government funding and support for the work that they do. At a practice level, we are doing more of what we've been doing, which is to really dig deep, really work with experts and local governments and municipal leaders all around issues as it relates to revitalization. So that's everything from code enforcement, all the way from land banking, all the way from looking at and managing municipal budgets as it relates in a post-COVID era. And then one of the most important things we're doing is really checking in with our local partners. We understand that they need support in this time, and our role as a national organization is to become a platform to help not only with some of the tactical support that they need, but also some of the social and emotional and financial support that we know that's coming. Thank you, Doug.
Great, thank you so much. So Maurice, let's turn to you. So LISC is a big national organization with a lot of moving parts. Can you give our audience a quick overview of LISC, as well as describing some of the ways you've been initially responding to the pandemic? Oh, you're on mute.
Can you hear me now?
There you go. Yes.
All right, Doug, thanks. And nice to be with you again. And I also want to say hello to all in the audience. And I want to particularly send thoughts and prayers for all of us during this really, really tough season. Just briefly, LISC is a national community development financial institution. We are a comprehensive community development organization, so we finance and provide technical assistance and other help on housing, small business, health, recreation, sports, safety, childcare. You name it, and we try to be involved in it. We've been around for about 40 years. With respect to this pandemic and recession combined, or economic decline combined, we have prioritized a handful of things that we're working on. First, it's trying to really provide immediate relief supports to small businesses. So we have formed a rapid relief and resiliency fund with which we're providing up to $10,000 in grants to small businesses. And we've had some great help from Verizon, from Walmart, from Sam's Store, from US Bank, and we've got others as well coming online. And it's been a huge success so far, but there's a lot of work to be done. The second area we're focusing on is also providing stay open support, if you will, for nonprofits that are providing valuable social services to residents in low and moderate income communities all across the country. And again, same sort of makeup in that we're providing grants to these nonprofits up to $10,000 to help them do their work. The third area we've been focusing on is technology, trying to help groups that need help with respect to technology. Again, providing small grants. So I'll give you an example. We work in a lot of rural areas. We work in 45 states, 2,200 rural counties. And a number of our residents and businesses there need help with now laptops so that they can work remotely or can do homework. We've been providing grant capital for folks to do that sort of work. And then the last area that I would highlight is we are a certified small business administration lender. So we have been through the Paycheck Protection Program providing loans to nonprofits and for-profits, though our focus has been primarily on the nonprofit sector in helping them to leverage that federal resource that's coming through, that's now over $600 billion coming through to support nonprofits and for-profits in this relief period of the coronavirus. We've been also, in addition to that, doing some policy work, trying to make sure that the relief and recovery measures coming out of the federal government and others are taking it or are serving the communities where we are working. And then in addition to that, we've been providing technical assistance to local governments and other groups during this period as well.
Great, thank you. And Maurice, just a point of clarification, were you a small business administration lender before PPP as well?
Yes.
Okay.
So we are a 7A lender. I should have mentioned that LISC is a family of 4 companies. One of our 4 companies is a company called MPhil, right, and they are a 7A small business lender. So yes, is the answer to that.
Got it, okay. Because I know the most recent round of Paycheck Protection Programs allows CDFIs to play that role more broadly. So that was a change.
Which is terrific. That is a change, and one that we've been advocating for with a bunch of other folks.
I'll bet. Great, thank you. So let's turn to you, Mikelle. So as a healthcare system, of course, Intermountain has played a primary role in treating the disease, the sick, those with the virus. But in addition to the direct role, can you tell us as well how Intermountain is responding to the pandemic at the community level?
Sure, thank you, Doug. So Intermountain Healthcare is an integrated health system. We're based in Salt Lake City, Utah, have 24 hospitals. One of those is virtual, serves about an 8-state region. And we also have a health plan and employed physicians, and have a very population health focus to our work. And we've been in existence since 1975. I saw one of the questions about the intersection of faith. Our organization was created when the Church of Jesus Christ of Latter-day Saints donated community hospitals and got out of the business of operating hospitals. And we are non-faith oriented now, nonprofit, governed by a volunteer board, a total of about 250 trustees that are involved in governance here. but the commitment has always been to addressing the needs of our community and being a model health system for the country. And that has definitely played into our response to COVID. We are thinking about this as certainly a responsibility as a health system to respond to both the health delivery needs that we need to be providing as hospitals and physicians and clinics and so on, but also thinking about the equity issues and social determinants of health factors that are contributing to illness in our communities. So our response has included a number of things. We have 25 testing sites that we've distributed all across our service area, including in rural and remote settings, and we keep moving them in response to where we see hotspots emerging. We redeployed an RV that we were using for genetic testing for a study to be a testing vehicle. It now moves around primarily to communities that are not inclined to drive themselves to testing sites, so that we can just post up right in a neighborhood or at a homeless resource center and other places and do that testing. We've also deployed some of our caregivers to places that are experiencing greater need than our part of the country at this point. We sent a team to New York Presbyterian and another team to Northwell to help New York in the crisis. And we have a group doing some work understanding the needs of the Navajo Nation right now as well, and trying to understand if we'll respond. We note something really interesting as this is unfolding, as we've now tested about 60,000 people across our service area. And wherever we go with our testing, we seem to attract the worried well, not the target population of those that we're seeking to serve in all cases. And so we've really moved away. We are actually trying to keep it secret from the media where we're going and how we're doing testing, and really relying on very grassroots, neighbor to neighbor, only working with small trusted community organizations to try to get the word out during hotspots. So I'll just mention one other thing that we've been doing, and that is collaboration from a volunteerism perspective. Early in this pandemic, we heard so much about PPE demands, and we continue to face challenges in our own health system, but also in skilled nursing facilities and congregate living situations for people to have the right amount of protective equipment. And so we partnered with the LDS Church, their charity group, and another health system in our community. And we have now, we purchased the materials to make 10 million masks, and we have 10,000 volunteers a week checking out kits to produce those masks. They have a week to sew them and turn them back in. We then launder them and use them for medical use, and we'll begin sharing them with some of the high need communities. So really appreciate those opportunities to partner even in delivery of healthcare.
That's really great. Well, thank you. And I'm sure everyone listening can really hear the range of responses. I think is really impressive. So let's turn to some questions. I do want to just reiterate for the audience. So on Twitter, we did put in the chat box everyone's handles, including our own. You can use the hashtag Network Commons if you'd like to tweet anything that you hear. And if you have questions for us, please use the Q&A box or tab down at the bottom of the screen. And if you have any technological issues or other issues, you can use the chat box. Okay, so chat for tech stuff and Q&A for questions. All right, so Akilah, I believe we are turning to you. Let's see here. Where's my question? Oh, there we go. Okay. So yeah, now I'd like to push a little further and think about some of the deeper implications of the pandemic, what it's revealing about our country's systems and institutions, and as we said, what you and your organizations, and hopefully many of you listening in, are doing to ensure that our communities are better off after this crisis than they were before. So Akilah, this Network Commons in many ways was inspired actually by your recent article in Shelter Force magazine that was titled "Community Development is Crucial in This Moment." We'll share it now in the chat box. And I want to point out, for those of you who might be from the public health or healthcare fields and are unfamiliar with Shelterforce, definitely take a look at that journal. It's a really excellent resource for the field. So Akilah, in your piece, you stress the importance of community development's role in the recovery, but you also highlight some important steps that need to be taken by funders and policymakers to help support that role. Can you tell us some of the main points from your piece?
Absolutely, and thank you, Doug. So a few things. First, I would like to thank Miriam and Shelterforce for sharing my words. I had no idea that it would resonate so deeply with the field. And so I really appreciate them as an institution and the work that they do. I also wanted to talk a bit about the piece and really about some of the main points. And it really had two main points. I mean, obviously, for funders and during this really chaotic time, it's very easy for them, and really because that's just the nature of the crisis we're in, to actually pull back from investments in community development and fund more kind of rapid response. And while that's important, I really wanted the field of community development to understand that we need to be stronger and really figure out what communities need at this time, and then figure out how do we get that to them. And two, I really wanted to not just have a generative piece, but have some really clear-cut strategies for funders. Because one of the things that, you know, I'm hearing a lot of good feedback around is that it's good to get like, okay, these are some of the specific things that we need. Like, we do need funders to lean in and invest more. The work that's ahead of us as a field is going to be great. We know local governments in particular are struggling. They're struggling to provide those essential services, but they're also going to be struggling with the rebuilding efforts that are going to be ahead for the foreseeable future. The other thing that I wanted to really highlight, and I know we'll get an opportunity to talk about this further, is that COVID did not particularly create a lot of the inequities that we are now all being confronted with. If you ask any of our colleagues, we will tell you sick pay, we will tell you housing insecurity has always been an issue. But now because of COVID, it's become exposed. And so a lot of the inequities and inequalities are being just really amplified. And so I think that this is a moment for us, right? I think for once, we don't have to sell the ideal of why housing security is important, why healthcare is a right and not a privilege, right? We don't have to sell this anymore because, you know, we know that we're interconnected. If I'm sick, you're sick, right? But I think one of the most important things that I don't want us to do is I don't want us to go back, right? And use old tools and really just kind of go and try to achieve the status quo again. This is giving us an opportunity to think more radical about what our solutions and interventions need to be. I think we need to lean in and double down and invest in strategies that work and invest more in those strategies. But I also think that we need to really figure out what does it mean for us to think out of the box. The world is listening to us now as a field. And I think it's important for us to say something that's meaningful, thoughtful, that pushes society forward, pushes it in a place where it can be more just. So I think while this is a crisis, a once in a lifetime crisis, this also gives us an opportunity to rebuild and rethink and reimagine what a more equitable future can look like. And that's the reason why I wrote this piece for Shelterforce, so it can help spur conversations like the one we're having today.
Great. Yeah, thank you. It's really inspiring. And I think your point about actionable next steps is really critical. So Mikelle, I've got a question for you then next. So you represent a large healthcare system that before the pandemic was making substantial headway in playing a larger role investing in the communities in order to address social determinants of health. Can you tell us a little bit about Intermountain's community investment work, and how has the pandemic influenced your system's thinking about this investment work?
Thanks, Doug. Intermountain's had a long history of having extensive community partnerships, primarily in the way of working together to deliver cross-sector solutions and offering grants, even through Intermountain, a foundation that we established more than 20 years ago. And that's all been great. But in the last, I would say, and in the last couple of years, we've really worked on a strategy of thinking about how do we use all of our assets at Intermountain, not just our ability to partner and give grants and ensure that we're creating good avenues for care, but also how do we use our purchasing power, our hiring capabilities, and our investment vehicles to impact well-being in our communities in a way that's much more upstream from the care that we're able to deliver. So we committed to an anchor mission several years ago. And what that means for us is we measure and monitor our investing in a social impact way. Our board committed 2% of our investment portfolio to be used for social or local impact investing. And we've got that very well organized now and underway. We also are monitoring our local purchasing and minority purchasing. And really, it's been really fun. We bring these two things together even in looking at how do we invest in small business to enable it to expand, to be able to meet our needs as a large organization. And then we're looking at our hiring practices. How do we create tighter connections to those that might not be the easiest for us to hire, and enable them to have equal opportunity or even advantaged opportunity to get jobs with Intermountain. And so this is really how we're thinking about our anchor mission, and that is even more important in light of the COVID issues that we're facing in our communities.
Mm-hmm. Yeah, thank you. No, it's and just to reiterate the anchor mission of investing locally, hiring locally, and purchasing locally, and 2% of your investment portfolio, like that's real money and manageable by a system like yours. So it's a really great model nationally. Let's turn to Let's turn to you, Maurice. You run one of the largest community development organizations in the country, as we discussed. You're also seen as a real thought leader, especially at the intersection of community development and health. You talked a little bit about LISC's immediate response to the pandemic, but how do you envision LISC, as well as the larger community development field, playing a role in, as we've been hearing, creating a better world after this than the world we've had before the pandemic started?
Yeah, well, thanks for that question. I would see a handful of items that I think will sort of rise to the top with respect to post-COVID. First and foremost, the importance of really addressing the technology gap in our country has really been highlighted by COVID. This gap was there obviously before COVID in this pandemic, but it has really been shown as something that we as a country, from the public sector to the private sector, have to invest more in to address for our rural areas, for our low and moderate income communities, for small businesses that need to work more remotely, for nonprofits and for-profits that are going to have to do more via e-commerce in some kind of e-commerce pathway. So I see the invitation, the call to be more aggressive in making sure that every place and all people have the kind of technological equipment and the ability to access the internet. I see this as being something that has certainly been highlighted once again by COVID. So I think you're going to see more focus on technology and addressing that gap. Mm-hmm. Secondly, look, the social determinants of health piece, if anybody doubted that should be a national imperative before COVID, I sure hope that people are getting it now. It wasn't surprising to those of us who are in the field that communities of color and poor communities were hardest hit by COVID. they were the most vulnerable. And this is, and I want to commend Intermountain for what they're doing. And we're in conversations with Intermountain right now about working with them. But we have got to get more partnerships that are addressing the social determinants of health, from housing to income to workforce, the whole gamut. We have got to do better at that, and I think you're going to see a re-emphasis on addressing the social determinants of health. Third area, I think you're going to see all of us making a recommitment to is being more intentional about the people and the places we're serving. This pandemic and this recession is hitting hardest communities of color and poor communities. There's no way to sugarcoat that. There is a reason for that. And as I say to people all the time, there is no way to really address these communities if you're not being intentional about it, if you're not focusing on what these communities need now and in the future. And so I see intentionality becoming an even bigger theme in what we're doing. And then lastly, I remember, and those of us in the community development field remember that the community development infrastructure's capacity was severely diminished by the recession of 08 to 10, and we have not recaptured that capacity. The risk here is that it takes another hit that we don't recover from. And so we really have to prioritize capacity sustaining and capacity building in our communities for if we want to make sure that we have organizations and people and the capacity to keep these places continuing to make advances and be ready for the next crisis. So capacity building is also going to be, I think, re-emphasized post-COVID.
That's great, thank you. And Akilah, can I have you build a bit on some of Maurice's comments? What are some of these steps? We talked about the increasingly exposed racial and community-based inequities. What are some of the steps that you think we can do to take to reduce these inequities and to build community resilience for the future?
Yeah, and I really want to just build off of Maurice's comments because I think, at the very least, we have to be intentional about what does it mean for us to deploy resources where they're needed, right? My fear is that we're going to not fully invest and double down in communities of color, in Black and Brown and Native communities that have been devastated and decimated by COVID. And that we will expect them to somehow bounce back and become resilient. That's not the case. We did lose a lot of capacity wealth from the 2008 global crisis. I'm scared that if we do not take a more focused approach, that we're going to lose the little bit of ground we were able to garner in the last 10 years. So having things like racially conscious policies are important. That's one of the things we have to do. Like, if we understand that comorbidities are disproportionately impacting communities of color, what does it mean for us to change the relationships between healthcare systems and communities of color? Like, what does it mean to do that? How does that happen? Does that happen with community healthcare centers? What does it mean for people to have employment where they have sick pay, right? That people do not have to feel like they have to go to work make a decision between their livelihood and their health, right? So this is an opportunity for us to really look at where the fractions in the social of the social contract, right, of American social contract with its citizens are, where those cracks at, especially for communities of color. And then we have to begin to rebuild trust and then be conscious and deploy resources in places where they're needed. We can no longer say, all boats are gonna rise with this level of investment. Like, for instance, when we look at the PPP program, a great program, in its spirit. But for 95% of businesses of color to not be able to, African American, and 91% for Latinx business owners, for them, for these communities to not be able, or my community to not be able to access federal resources to be able to keep our small businesses strong, that's a huge issue. Because when we lose those small businesses and we lose the ability for people to become employed and hired, and then we lose needed tax revenue for local government, you know, this becomes a huge issue for more and more problems, right? So in short, in terms of what do we do next? Like, we know about comorbidities, we know about historical relationships, we know about employment systems that do not take into account some of the unique challenges of the most vulnerable in society. We have to fix those. We have to lean into where the challenges have been, and then begin to bring ideas that work, but also to begin to think more radical and to imagine what does it look like for us to build an equitable community, and then begin to do that, even if ideas sound really just very different than what we've originally been thinking of. So, I mean, it's a both and. You know, when I think about an organization like the Center for Community Progress, I mean, our work really, as it relates to health, is really about how do we help local governments be able to take over properties that have been basically left abandoned and they have become nuisance for communities. But we also are working with structures that actually have families in them, right? Like, so when we look at issues like code enforcement and making sure that no, families are living in places that are asbestos free, that don't have lead, you know, and how do we really work with local governments to be able to keep that up and to do it in a way that's really going to like put families at the center. Those are resources that a lot of local governments don't have. So it's important for organizations like myself and my other panelists to bring those resources to bear for local governments, because we know they're going to be strapped in the next few weeks. So it is a very comprehensive strategy. I know this is a very kind of long-winded answer. I tried to give both the whole idea of how we need to have fundamental paradigm shifts, but we also have to do what we all do best in our organizations to help our constituency. But then we also fundamentally, we have to go where the pain is and then begin to do some of that healing and bringing some of the best strategies and ideas and interventions.
Mm-hmm. Yeah, thank you very much, Akilah. And some of this applies to my question for you, Mikelle, which is what can you say to encourage healthcare systems, hospitals to continue this sort of social determinants of health investment, to continue to support organizations like Akilah's, like others, given that they are being hit really hard by higher costs right now, by reduced revenue, and in many cases, we've seen the stock markets all over the place. So having, you know, there's going to be, it seems like and I'm hearing there's a great risk of pulling back. So what, because you guys are not pulling back, what can you say to other organizations to keep pushing forward?
Thanks, Doug. And I noticed in the thread of questions that someone was asking about how to influence a health system to take this approach to anchor work. And so I'll think about it from both perspectives. But first, let me say that I think it would be impossible for health systems to be ignoring the inequities that are occurring right now. As Maurice and Akilah have mentioned, these disparities are not new in any way, shape, or form, and yet they are impossible for us to ignore today. And that presents, I think, an opportunity for community organizations to approach health systems and ask for assistance, not only in just addressing the immediate need of getting testing to underserved communities for COVID and ensuring that that we're supporting in delivering care, but also thinking about the things that we can do to establish partnerships that survive COVID and help with the more upstream issues that we have to work together. We are, I feel like Intermountain has always been at the table with our community organizations, organizations that are serving underserved minority populations. And yet it's amazing to me how many new partnerships we've been forming in recent weeks or the problems we've found in the way that our partnerships were even working, or the consternation that exists between one community organization and another. These things are much more visible to us because we're working on an acute problem. And that presents an opportunity for working going forward. All hospital systems, I believe, have the capacity to commit to an anchor mission, regardless of the downturn we're all going to face in our communities. And in fact, it's probably the most important time to double down on those efforts, because we know that employment is going to be critical to moving out of a recession, and hospitals are likely to be the largest employer in their community through this crisis and beyond. They are today. And that creates a wonderful opportunity for us to influence from a hiring perspective. Purchasing, our supply chains have been dramatically impacted during the COVID pandemic, and relying on local suppliers will be a focus for health systems in the near future, because we'll want to have uninterrupted supply chains. It'll be top of mind for a while, and that presents opportunity. And then finally, while our investment portfolio has been hit just like everyone else's, that doesn't change the opportunity to use 2% of that portfolio for impact investment. And there's lots of new partners right now because of the different loans and opportunities that are out there. I think it presents a remarkable opportunity. We are seeing new ways to deploy those funds. So I'd encourage people to continue to push for health systems to go this direction. We have 45 peer health systems who are a part of the Healthcare Anchor Network and have made this commitment. And I believe there really is a movement afoot, and it should not slow. I'll make one final point, and that is, we've been on a journey in healthcare as a country towards value and away from fee-for-service motivated healthcare. It is essential that we continue in that direction for the good well-being of our country. Healthcare is not affordable. It is taking way too much of our gross domestic product. And as we face increasing levels potentially of higher uninsured, people who are insured differently, maybe moving away from large business or large employer offered insurance onto individual exchanges, it's just going to get more difficult. And so we need to continue our push as a nation towards paying for value, paying for health systems to keep us well. And that will encourage all health systems to be more motivated to think about these determinants of health and how we keep people well. And COVID is showing us that in spades.
Great, thank you so much. And it's interesting. One of the things that's been on my mind lately is that 2% you mentioned in your portfolio. Right now, if that were lent out at 3 or 4% interest to affordable housing developers, that'd be a pretty good return right about now, given this dropping in the stock market. So it all depends on how you frame something like that, I think.
You're right.
So I'm looking at, this has been fantastic, and I've been reviewing some of the questions we're getting, some of the questions we had from early on. And I'm going to take one, Maurice, actually, this is a question for you in terms of, it really builds actually directly on what Mikelle said, which is how can healthcare partner with community development and community-based organizations as part of this inclusive recovery?
So healthcare is right now the fastest growing sector of partnership that LISC has. Hospitals are the new anchor tenants for our work and have been now for the last 3+ years. And what we're doing with them, I'll just give you some examples. We are forming essentially social determinants of health funds that include a mix of grant capital, low interest debt capital that both the hospital and we are investing in. We're managing this fund and making investments in housing for low and moderate income areas, in small businesses, in commercial corridors. So to the point that was being made, in most of the places where we work, the anchor institutions, often the largest employers and the largest influences of economic health in the community, are hospitals. And so hospitals can use both philanthropic and treasury dollars to actually make community development investments in housing and other factors that can influence in a positive way these social determinants of health. And they can get back both a financial return and a positive return on the overall improvement in people's health. We just, so you know, Doug, we, at the end of 2017, we committed as a company to investing $10 billion in the next 10 years to address what we thought was the North Star when it comes to social determinants of health. And that is the life expectancy gaps that we see between census tracts that are hard pressed and census tracts that are more affluent. And in most places where we work, that life expectancy gap is 10, 20, and 30 years, in some places difference. We committed that we were going to make the investments necessary to address those life expectancy gaps. And as most folks know, in the health space, it's not actually what happens in the clinical walls that determine that gap. It's what happens in the places where people live. The census tract that you live in is the best predictor of your life expectancy. And so what we've been doing is partnering with hospitals to make the kind of community development investments that actually lead to better health, to better well-being, to getting mold out of houses, to helping people get prepared for jobs that pay livable wages, to preparing or developing or preserving housing for folks at all levels of the income spectrum. Hospitals are our biggest partners in this now. They are both investors, they are providers of talent and strategic advice. They also have data on the patients that they're seeing, principally patients coming through their emergency room. So hospitals are a part and parcel of the community development infrastructure in every place where they work. And we're trying to partner with them to do the work.
Great. I actually have a specific follow-up question that's for you, Maurice, from Jespi Varespe at Old Brooklyn CDC.
Oh, yes.
The question is whether the pool that you're discussing or that you're developing, it has a geographic focus. Is it national?
So we have multiple funds, right? We have a national fund that focuses on, and this is just with hospitals that I'm talking about now, a national fund that focuses on commercial corridors and small business investing and preparing people for work. But we also have funds that are focused on certain geographies. We've got a fund down in Charlotte where Atrium Health and Novant are focusing on health. We got a fund out in the Bay Area where Kaiser Permanente is focused on housing. So these funds can be local, they can be national, they can be regional. There is no limitation to the geographic places that these funds can actually focus on.
Mm-hmm. And of course, some of the other big, especially the big national CDFIs, have similar funds that
Absolutely.
play different roles. And so, a lot of opportunities there.
But make no mistake about it, healthcare enterprises are anchor tenants of community development work. And I hope that will be the case. I commend Intermountain and others. I hope that will be the case for decades because we need it if we're going to make true improvement in these communities.
Well, we got a question, Mikelle, from Anne-Marie Knight, who asked if you can give an example or two of the types of things that 2% you mentioned from your investment portfolio has gone towards. Is there anything you can share with us for some specificity?
Yeah, I'll share two projects that are really different. One is investment in an affordable housing fund. in Salt Lake, like many places, there's been great affordable housing built over the years that takes advantage of different incentives and market initiatives. And then that housing ends up getting sold after those commitments are met. And a developer comes in, remodels that housing, and it is no longer affordable. And we see as much affordable housing stock leaving as we do coming in with those incentives. So Intermountain, along with a philanthropist and a major regional bank here, have created an affordable housing fund. That fund will buy housing as it's coming on the market and maintain it as affordable, using some of the dollars, particularly the philanthropic dollars, to do, to rehab those houses or units and ensure that they are good quality housing, but maintain the market rate the rate of rent as affordable. Intermountain will also do some of the things that Maurice spoke to. We will provide some support to the case managers that work in support of that housing, so that the tenants have access to medical care, some nutrition classes and prevention services, and we'll track data together on things on social outcomes and economic outcomes, like the people having opportunity to work, but also health outcomes. And we're really excited about this and think it has great potential. We'll be looking for additional investors and hoping to grow that program. Another is a really specific loan that we're making to an organization called First Step House. First Step House is a drug treatment provider that has been in our community for decades, and Intermountain has provided philanthropic grants to First Step House to extend their services. But we last week signed a loan that will enable them to expand their sober living housing and their treatment facilities. So they will break ground on an expansion with our loan. And then we are also continuing to fund services directly through our philanthropic resources. So the possibilities are endless, and we're just getting started. And Maurice, we're excited to work with you.
Mm-hmm. That's great. Yeah, I think that sort of specificity can be really helpful. And one term one thing that you mentioned, which I think is important, that it was new to me recently, is something called naturally occurring affordable housing, or NOAH, which is exactly what you're doing, is buying affordable housing, but then protecting it. So in many cases, efforts like yours, organizations like LISC, are the first step to preventing gentrification by helping buy up and permanently protect those properties. Akilah, we've got a couple questions I'm going to aim at you initially. So it's a pair from Risa Wilkerson and Maggie Parker, and I'm going to read them together just because they're sort of getting at the same thing. How do we rebuild trust in an increasingly polarized country? How do we strengthen social connections and prioritize absolutely belonging for all people so that we can work together to build a more just and resilient tomorrow? And then Maggie Parker added, what are some ideas that would be radical and reshape the narrative? Thought you might have some thoughts about that, this radical, how do we reshape the narrative of where we're going? Hope you're on mute, Akilah. She said brilliant things, I'm sure.
Yes. Here we go.
There you go.
There we go. Thank you about that.
Thank you.
Want to thank people for those questions, and let me just jump in. I know we don't have that much time left. How do we rebuild trust? There's a lot of things I can say, but for the sake of this conversation, we as institutions have to we have to first engage the community, right? Care about what they say, engage them in a process, and then do what we say we're going to do, keep our promises. As it relates to health, I mean, we could think of things as much as, having school-based clinics are a great example. Or when we think about like living room clinical models that are happening on the west side of Chicago, where people are using vacant and abandoned storefronts or vacant and abandoned homes and transforming them in for local healthcare centers, right? So things like that, that show that institutions are coming to community, that they value community. Hiring community, that's always a great thing to do. Like, what are the jobs that we can actually employ local community in? How can we train them up? How can we employ them? How can we give them benefits? Again, these are all great, simple ideas, but radical in some other circles. And I want to be clear too about just thinking about how we can just reimagine what it's like to build equitable communities. We have a lot of great ideas on the table that just don't get the time, energy, and capital behind them. We need to make sure those ideas can rise to the top, and then seed them and grow them, and then figure out how do we replicate those great ideas across the country, taking into account local differences, local culture, local regional differences. So I think there are a lot of great ideas we can try, but I also think we also need to open up some space in the field so we can invite even more community voices to the table, so we can begin to truth test some of our ideals for the future. So I think those are just some like real kind of clear, but also some more process related ways that we can engage the community and continue to build trust.
Super, thank you. And I'm incredulous that we're running out of time here. So I want to give the three of you, I just want to thank everybody for all the amazing questions. And many of them our panelists have seen. We'll see if there's anything we can do with them, try to get answers, but I want to make sure we give a chance for our three panelists to have a last comment, anything they'd like to highlight or reiterate before we close out. So why don't we start, Mikelle, why don't we start with you?
Sure. I'll just close by saying thank you so much, Doug, to Build Healthy Places Network, and to my colleagues here on the panel. I love some of the discussion we've had about reframing and thinking about how we deliver healthcare differently in the future and partner from a community development perspective. You can count on Intermountain to be a part of that in our communities and to also be a voice for that with other health systems. Please do seek out these opportunities to partner with your health system, maybe around the COVID pandemic as it's unfolding, but building those partnerships for the future. I agree with everything Maurice said. We are likely to be an anchor tenant in your communities for the foreseeable future. And that creates a great opportunity and a great responsibility. And I encourage us to be in it together. Thank you.
Great, thank you. Akilah, closing words?
Sure. Would love to thank the Building Healthy Places Network again, and I would like to also thank my panelists, my fellow panelists today. Just three quick things. I encourage everyone to go to communityprogress.net/COVID-19. We have a lot of great resources for local government, for state government, and a lot of federal resources too. Also, we are having a policy webinar tomorrow, really looking at some federal action breakdown for local governments. And again, I think that would be a great resource. It's tomorrow, May 7th. You can go to our website at communityprogress.net and sign up. And last, I encourage you all to follow me, Dr. Akilah WB, or C Progress News on Twitter. We share a lot of learning resources and opportunities, and we keep them up to date. So I appreciate everyone again for their time and willingness to listen to some really, really smart people who care deeply about this work. So thank you so much, Doug.
Great, thank you. And Maurice, before I turn it to you, I'm just going to say that we're going to send out a short questionnaire to folks on the panel or on the call today to tell us how we can do this better in the future. And we're going to send out an email to everybody with a lot of the links and information that we've shared today. So Maurice, closing words.
Sure. I offer my thanks as well to you, Doug, to Akilah, to Mikelle. It's nice to be with you all. Look, I want to make sure as we're thinking about where we need to step up as a country, as institutions, to be helpful to the vulnerable, that we keep rural also in mind. 20% of the population still lives in rural America. We need rural America to be robust if we're going to be a great, sustainable country. So let's keep rural in mind. And then the last thing I would just say is, look, we know how to do this investment, right? We know how to put together the right capital stacks. We know how to originate deals. We know how to manage assets. That's usually not the toughest part. The toughest part is the reconciliation that still needs to occur between communities, between people, between races, gender. That's the real work that we as a country still need to do if we're going to be sustainably great, if we're going to live into the promise that this country started with. And so I want to urge us, as we're thinking about the how, if we're going to have that trust that we need to do great things, to work miracles, we got to be reconciled. We got to have a high functioning team. And there's still work to be done in that regard. So I hope that this pandemic and this recession causes us all to choose again to be great teammates. That's what we need.
That's great. Well, thank you, Maurice. As always, inspirational closing words. And again, I encourage people to click on the chat box. Tell us about other speakers you'd like to see or other topics. Check out our SurveyMonkey, and we will see you soon for our next Network Commons. Thank you all. And I want to thank you all as the speakers. Bye-bye.
Thank you. Thanks.
Bye.
Thanks. Bye.